If you are an avid movie watcher, I know for a fact you already know everything about strangulation because you get to see various ways victims get strangulated in movies. But then from examination point of view, entrance and university point of view, let's learn something about strangulation. Just like hanging, strangulation leads to asphyxia. And just like hanging, strangulation leads to asphyxia by neck compression. But in hanging, the constricting force is applied by the weight of the hanging body. But in strangulation, the constricting force is not by the weight of suspended body. That is, the constricting force is something else. And what is the constricting force then? Depending on the type of constricting force, you have strangulation of various types, which you'll learn about soon enough. But first, we are going to learn about the external and internal autopsy findings of strangulation. So, external autopsy findings, I have divided them into three. First, the external signs of asphyxia, which I have already taught you under the topic of asphyxia. You're going to see cyanosis and congestion. You're going to see Tordos spots or petechial hemorrhage, and then you're going to see voiding of urine, semen and stool due to loosening of the sphincter. Good, good. The same is true for hanging as well. Then you have external signs of force. See, if a ligature has been used to strangulate you, you're going to get a ligature mark. If hand has been used to strangulate you, you're going to get sixpenny bruise. Then there are signs of external signs of struggle, which includes nose and ear bleeding. And see, when you are being strangulated with a ligature, you're gonna struggle against it, try to release yourself from the strangulation, right, from the ligature. As a result, there is friction in between the neck and the rough ligature, leading to friction burn and blister formation. So there can be friction burn. So let's revise all these external autopsy findings. So first are signs of asphyxia, where you get congestion and petechiae. Just above the level of obstruction, there is congestion. Second, you have signs of force, where you get ligature mark if a ligature has been used and sixpenny bruise with nail marks if hand has been used. Then you get signs of struggle, nasal bleeding, ear bleeding and blister formation due to friction burn. Next, internal autopsy finding. And in any case of neck compression, I repeat, in any case of neck compression, you look at the internal autopsy finding on the basis of layers of the neck. See, you already saw the skin in external autopsy finding. Now you remove the skin, what do you get? Subcutaneous tissue. You remove the subcutaneous tissue, what do you get? You get neck muscles. You remove the neck muscle, what do you get? You get cartilage and bone. What cartilage and bone? You get thyroid cartilage. Then you get hyoid bone. And then you get cricoid cartilage. You remove the cartilage and bone, what do you get? You get the inside of the larynx. Subcutaneous tissue. Remember, in hanging, the subcutaneous tissue was compressed for a long period of time. That is why it was white, glistening, hard, parchment-like. But in case of strangulation, your neck is compressed with extensive force, right? In hanging, it was compressed with less force for a long period of time. In strangulation, it's compressed with extensive force. Since subcutaneous tissue is compressed with extensive force, it becomes soft, red and hemorrhagic. In case of hanging, neck muscle didn't show any contusion and hemorrhage. Here, due to extensive force, there is contusion and hemorrhage of the neck muscle. In thyroid cartilage, like in hanging, here also there is superior horn fracture. In hyoid bone, just like hanging, here is also the greater cornu fracture. But in hanging, there was abduction fracture or side to side fracture. Here there is adduction fracture. Makes sense, because in strangulation, you are compressing the neck inside. So if the greater cornu fracture, it will move inside, leading to adduction fracture. Cricoid cartilage, if there is extensive force, you might be able to appreciate cricoid cartilage fracture. And in case of larynx, there is bleeding in the anterior and lateral surface. But remember, if posterior esophageal surface is bleeding, then that is not due to trauma. That is Prinsloo-Gordon artifact. What is Prinsloo-Gordon artifact? I have already explained under the topic of hanging itself. And to avoid Prinsloo-Gordon artifact, what do you carry out? You carry out bloodless dissection. What is bloodless dissection? Bloodless dissection is such a dissection where the brain is the skull is opened first, and then the abdomen is opened, and then the neck is opened at last. Revision time. So what is this? There is strap muscle. Strap muscle refers to the infrahyoid muscle of the neck. Strap muscle contusion. What is this? This is strap muscle hemorrhage. What is this? There is thyroid and hyoid fracture. What is this? The superior horn, right? The superior horn of thyroid is cartilage is fractured. What is this? There is laryngeal bleeding, laryngeal hemorrhage below the level of vocal cord, below vocal cord in the anterior surface, anterolateral surface. What is this? This is Prinsloo-Gordon artifact where there is bleeding in the posterior surface of the esophagus. Artifact, Prinsloo-Gordon artifact. Okay, now the more fun part. Okay, so you have various types of strangulation depending on the various methods of neck compression. If a ligature is used, we call that ligature strangulation. If hand is used, we call that manual strangulation, also referred to as throttling. If bend of elbow or the anterior aspect of forearm is used, we call that mugging. If bamboo sticks are used, we call that bansdola. If iron cuff is used, we call that garroting. Okay, revision time. What is this? Here, ligature is used, so we call that ligature strangulation. Hand is used, we call this manual strangulation or throttling. Bend of elbow is used, we call this mugging. Bamboo sticks are used, we call this bansdola. Iron cuff is used, garroting. Starting off with ligature strangulation. Ligature strangulation leads to ligature mark. Now you need to be able to differentiate ligature mark due to hanging and ligature mark due to ligature strangulation. See, ligature mark due to hanging mostly was what? So mostly the hanging is via a fixed knot and a fixed noose, because people, they don't know how to make slip knot and a slip nose with a runny nose. So the ligature mark is oblique, incomplete, there is gap with suspension peak and above the thyroid, because even though the ligature is below the thyroid, due to the weight of the suspended body, it slips upward. But in case of strangulation, see, what is there? I am strangulating myself. What is this? It is complete, it is transverse, and it is above or below thyroid, depending on where I strangulate, above or below, but mostly below thyroid, because below thyroid I can feel the strangulation even more. So it is complete, it is transverse, it can be above or below thyroid. Now it can be oblique in one case. Which case? You have seen in movies lots of time. If you are strangulated, right, and then dragged behind, as you are dragged behind, the ligature becomes oblique. So if you get dragged behind, you might have seen in movies where victims, they are strangulated or neck is wrapped with a ligature, then the ligature is tied to a vehicle, the vehicle runs and the victim is dragged on the ground. right? There you get oblique ligature mark. You need to be able to differentiate ligature mark from pseudo ligature mark. Pseudo ligature mark. Pseudo ligature mark is not due to strangulation, it is due to skin fold. For example, in case of obese and elderly. Okay, manual strangulation leads to 6 penny bruise. 6 penny bruise you can see right here. So there is bruising due to the thumb of the fingertips. Fingertips lead to bruising, and the nails, they lead to scratch abrasions or nail marks. You can see that only one hand has been used here. There's the thumb and then the rest of the 4 fingers. Both the hands have been used. Thumb and then the rest of the 4 fingers. Thumb and then the rest of the 4 fingers. You can see right here. You can see bruising due to the fingertips, nail marks, and bleeding from the nose as well. Next is mugging, which is of 2 types. If the anterior aspect of forearm is used, we call that chokehold, which leads to compression of your airway tract, trachea gets compressed. If you use the angle of the elbow, then that is referred to as a carotid sleeper. So here, as the name suggests, what is being compressed on both sides bilaterally, the carotids are compressed, leading to cerebral hypoperfusion. Here is bastola, where the neck is compressed in between 2 bamboo sticks tied at one end. But there are other ways to perform this as well. 2 bamboo sticks pushed against one another and in between sandwiched is the neck. Or the same thing, 2 bamboo sticks tied at one end and then brought closer to one another, approximated, compressing the neck. And then there can be one method where the victim is against the ground and the bamboo is pushed against the victim, as you can see right here. Then there's garroting. This particular type of garroting that I have shown you with the help of picture is your Spanish windlass technique, which was used in Spain and France. It is a variant or a type of garroting, and the use was for judicial punishment or judicial execution. Other ways garroting can be performed is with the help of this iron string. It is wrapped around the neck and then pulled. The neck is wrapped around and then force is applied in the neck. And with that, we are done with the various types of strangulation.